Hi everyone, welcome back. So some of you may have seen my previous post on massage for children with cerebral palsy, which is a sort of special area of interest for me, where I sort of very briefly shared benefits of massage for CP. But I'm going to sort of talk a little bit more and explain the different types of cerebral palsy, and again, how massage can help and just things to be aware of. Now, this can apply to sort of parents of children with cerebral palsy. Maybe your child has just been diagnosed, or you've sort of known for a while, but just looking for sort of a new treatment to try. And it can apply to either massage in terms of a therapist such as myself, providing the treatment, or it can apply, to if, say, I was to teach you as a parent how to massage your child. So, obviously with cerebral palsy, it's caused by some kind of brain injury, which usually occurs during fetal development, but it can occur actually during the delivery process itself, or even shortly after birth. And it's estimated that it's probably one of sort of very common disabilities. It's estimated that 2 to 2.5 children per 1,000 in the UK have cerebral palsy. So that's about 1,800 babies or infants being diagnosed with cerebral palsy every year in the UK. Now, there's thought to be approximately 30,000 children in the UK with cerebral palsy, and that's just children. So you've got obviously adults on top of that. So that's quite a high number. Now, as I said, there are different types of cerebral palsy. And each different type will involve damage to a different part of the brain. And so therefore the symptoms of each type and how they affect body movement and muscle coordination and posture, that's going to be different in each type, because of depending on the area of the brain. So I'm going to go through those different types of CP now. So the first one, and certainly the most common form of cerebral palsy, which occurs in about 50 to 80% of sort of all cases of cerebral palsy, is spastic cerebral palsy. Now, I particularly know a lot about this area because my daughter has spastic cerebral palsy. And it can result in sort of stiff, jerky sort of movements, quite a limited movement. There may be difficulty in moving from one position to another. Maybe difficulty in holding onto things or letting go of things. And also in areas where there is particularly sort of, excessive high muscle tone. The tight muscles antagonists may completely let go. So, for example, if we looked at, for example, in my daughter, it was her hamstrings were always very, very tight. And this was, demonstrated by the fact she, quite often wouldn't get her heels down on the floor. So her quads were going to sort of probably be weaker a lot of the time because of that sort of excessive high muscle tone. Now, the second type of cerebral palsy, which is probably the second most common type, affecting 20 to 30% of all cases, is athetoid cerebral palsy. So this is less common than spastic CP, and it's caused by damage to the cerebellum in the brain, or the basal ganglia, so they're sort of round the back, lower part of the skull, lower part of the brain rather. And these areas basically are responsible for processing signals that basically enable smooth, coordinated movements and also help maintain body posture. So daily activities, athetoid is where, you know, that there can be sort of more floppiness than spasticity. There's very low muscle tone. And so daily activities, so just things like speaking, feeding, reaching for things and grasping objects, or any other skills that require coordinated movements, are going to be affected in this type of CP. Now, the third type, which is the least common form, is ataxic cerebral palsy. And this probably affects about 5 to 10% of all cases of CP, and really involves sort of chronic shaking, tremors, poor balance. Quite often children with this type of CP will be very, very prone to falling over. There's very low muscle tone again, and poor coordination of movement. And when you see a child with this type of CP, they just look very unsteady on their feet if they are walking, and very shaky. And, you know, their whole sort of sense of balance and depth perception will certainly be, you know, affected. Now, there are, in about 10 to 20% of cases of CP, there may be a mixed sort of characteristics. It may be a mixed type of CP. So now this can happen in varying combinations of those three types that I've just mentioned. But mixed type will almost certainly always have both the hypertonic muscles, so the excessively tight muscles that we see in spastic CP, and also it will include those sort of involuntary movements of athetoid cerebral palsy. And this mixed CP comes about from injuries in both the pyramidal and extrapyramidal areas of the brain. It may also quite often be, well, any type of CP actually can also be classified by sort of certain terms depending on what part of the body is affected. So, for example, hemiplegia, if you sort of split the body vertically and one side there was sort of weakness, that would be hemiplegic CP. Diplegic, if you sort of cut horizontally, so it'd be like maybe waist down or waist up would be affected. So in my daughter's case, waist down just didn't work as well. So both the arms or both the legs. And then, of course, you've got quadriplegic CP, which, of course, means that all the extremities, arms and legs, are affected to some extent. Now, massage certainly has a valuable role to play in improving the quality of life of, you know, a child with CP. It can reduce, you know, physical symptoms such as the spasticity, and also improve those sort of fine and gross motor movements, which really help improve daily functioning. There's also reason to believe that massage can help improve the cognitive processes, social interaction and daily functioning. So in terms of cognition, you know, it's known that some Some children with CP actually have, even if they appear otherwise normal apart from their movement, for example, it can be that when they go to school, maybe just the way they process, quite often in maths, how they process things like symmetry and shapes can be different to how a non-CP child, would process that information. Now, in terms of the benefits of massage, certainly, as we've said, it can increase or reduce muscle tone. So it can work on the high tone of spastic CP and low tone that you see in athetoid or ataxic CP. And it really just depends on how you apply the massage and what techniques you are using. So we can reduce spasticity, we can encourage muscle flexibility as we would in any other massage client. It will encourage motor function, and just sort of generally help loosen any tight muscles, which obviously holding bones and joints in a particular position. So sometimes, children with CP, for example, might have maybe a pelvic tilt because of tightness in their hamstrings. And that can then obviously impact on other joints in the body. So massage can help improve this. And by increasing flexibility in the joints, you're going to help increase range of motion, and further, help to ease muscle tension and stiffness, and lessening, those spasms in the muscles, which sometimes can be quite painful, and in some cases keep children awake at night. Massage will also certainly encourage normal bowel function and improve digestion. Now, this is one of the areas where I would use massage on my daughter, because sometimes just that peristaltic movement of the bowel, can be really quite sluggish, and making them prone to constipation or a blocked bowel. And, no one really wants to have their child on laxatives if they can help it, and certainly not suppositories, because, it's not nice for the child, really. So, if you can sort of assist with that peristaltic movement, improve digestion, improve nutritional, uptake of nutrients, and, help prevent those blocked bowels, which can, the process of that, if it gets to a certain extent, it can go on for, a few years, and it can really take time for that child to get back into a normal pattern. So, if you can find a natural way to deal with that, then why not? And of course, massage can also help, reduce any problems with sleeping. And as I just said a little while ago, sometimes, particularly in spastic CP, where children get muscle spasms, they can be quite painful and they can interfere with sleeping patterns. Now, so those are the most common benefits of massage in children with CP. But research has also shown that massage may help improve, as we've said, those cognitive processes. So, helping when they go to school with things like maths. It may also encourage, just through sort of improving daily functioning. So encourage sort of social and dressing scores on the developmental profile. Increase positive facial expressions, in children where verbal communication is maybe either limited or just not happening at all. Massage can just help to kind of increase facial expressions and that non-verbal communication, which obviously then can really positively impact on sort of, bonding within the family and then with the wider sort of social circle. It can also reduce limb activity during face-to-face play interactions. And so sort of certainly with a child maybe with athetoid CP, where there are those involuntary movements, it can just help to calm that down a bit as well. Now, research has also looked at sort of the increase in circulation, which we know is a benefit of massage. But it's also seen sort of improved circulation in paralysed limbs, where a sort of a change of in colour of the skin and the temperature of the limbs that are affected has been noted, which is sort of further evidence of this improved circulation. Passive range of motion movements and stretches can also help, maintain and increase flexibility, and also help prevent muscle contractures, which of course can, be painful and cause spasms and all the rest of it. So those passive range of motion movements would be kind of similar to maybe if some of you have had something, like passive stretching in a sports massage, for example. It can be similar to that kind of thing. So it's just where the therapist or parent just offers the resistance, sort of performs the movement, but just offers a bit of resistance, at the same time. Now, there are some precautions. If you are a parent looking to learn massage or take your child to a massage therapist, or if you are a massage therapist looking to kind of go into this area, you do need to be aware that, children and adolescents may kind of have a little bit of fear of being massaged by basically a stranger. They may be, quite apprehensive about touch and about their body image, if they're an older child, and more aware of their disability. And so consideration really has to be given, to introducing touch in an appropriate way so that you gain that child's trust, sort of in the early stages, particularly of treatment. Verbal communication, as we've said, may be an issue. So recognising non-verbal communication, so things like those facial expressions, breathing patterns, will allow you as the therapist to be aware of your client's needs and also their comfort level, and just ensure, that you don't kind of cross over any boundaries. Okay, so I know I say this all the time, but this really is important, that if you are seeking massage therapy for anyone with cerebral palsy, but particularly for a child, you must make sure that you see a therapist who is experienced in this area and qualified, but also possibly even, just as important is to get a therapist who is registered and also insured. And a lot of them aren't. Okay, so do ask questions. You can ask for sort of proof of their registration and insurance. They're not going to mind you asking if they are genuinely registered and insured. Yeah, I mean, I completely understand, obviously, from, my own experience with my daughter, that it can be extremely difficult trying to access treatments for your child with CP. And when you do find them, sometimes they can be really quite costly. So massage is definitely worth a go as a sort of a maintenance sort of healthcare measure to work alongside, whatever physiotherapy, etc. your child might be having. if you've got any questions at all, do get in touch, do ask me, I will come back to you. You can subscribe to my channel. There's lots more posts available. And feel free to leave a comment or contact me through my Facebook or Instagram. I'm on both of those as the Medical Massage Lady. And as I say, I will answer you. So, but that's really all from me on this topic for now. So hopefully it's just given you a bit more information, a bit more understanding, particularly if maybe your child has only just been diagnosed. It can be quite a sort of overwhelming time trying to sort of get your head around all the information that you're being given. It does get easier. So but yeah, so that's all from me for the moment. So until next time, that's it. Take care. See you later.